So good morning, everybody. Welcome to Hope Hospice's Family Caregiver Education Series. I'm Debbie Emerson, Hope's Community Health Educator and Certified Dementia Specialist. I've been with Hope since 2014 as the facilitator of our Family Caregiver Program. And in addition to my 30-plus years experience as a health educator, I have many years of experience as a family caregiver for loved ones with dementia. So my goal today is to share info with you that's based both on my professional training and research and my personal experiences. So now today's webinar is a little bit different in that we're going to be talking directly with those viewers who are here because of an anticipated or a new dementia diagnosis. But today's presentation is also for the care partners in attendance. As care partners, you are intimately involved in the lives of your loved ones. So you also need to be aware of all of this information. It can help you do a better job understanding what your loved one is experiencing as he or she faces this, well, it's a scary diagnosis. And the reality is a dementia diagnosis will impact you, the caregiver, and the rest of your family just as much as it will your loved one. So my co-presenter for today is Gia Barcel, Hope's Manager of Dementia Services and Community Education. So Gia.
Thank you, Debbie. So like Debbie mentioned, I am Hope Hospice's Manager of Dementia Services and Community Education, and I'm TIPA Snow certified. I am a TIPA Snow certified dementia consultant and trainer. What that means is TIPA Snow is kind of our dementia educator guru, and I am well-versed in her practices and her approaches. I look forward to talking with you today about a new diagnosis and your next steps. And my hope is that after today, you will have learned some things, feel a little bit more in control about your future, as well as recognize that you aren't alone along this journey. So we have recordings of our previous webinars available to you on our website. Just go ahead and go to our website, which is the address on the screen, and scroll down to view what's available. Additionally, the website contains links to our resources for each webinar, which is really, really valuable. There's some great information there. This slide tells you a little bit about what we're going to be talking about today. So we'll do a short dementia basics review. We'll talk about the benefits of getting an early diagnosis, discuss emotions and treatments, planning for the future, and some strategies for living well, because it is possible. We've allowed time for questions at the end. So as we go, jot down any questions you come up with and we'll address them then. Or as Debbie said, because we are such a small group, we may be able to grab onto a couple that are appropriate for the information being shared and we'll address them then. So let's get started.
Okay, I'd like to start with a passage that reflects our goal for today's presentation, and that is how to live well with dementia. So a diagnosis of dementia does not mean that your life is over, nor does it define who you are. It means, however, that there will be challenges and obstacles ahead, not only for you, but for your family and friends. Thinking about those challenges now will help prepare all involved for what the future may hold. And according to one of the nation's leading dementia care gurus, as Gia mentioned, TIPA Snow, quote, "You are who you've always been, but now you're different. You're living with dementia. It's not always easy, but it's always interesting," unquote.
Every system in the body experiences age-related changes. Bones and muscles, bladder and bowel, skin, vision, hearing. Our heart has to work harder as we age. Our cognitive abilities, so that's our memory and our thinking, can change too. Changes can start as young as age 30. Normal aging means slowing down a little bit, but it doesn't include losing function. In other words, we're still very capable. It just may take us longer to get there. MCI, or mild cognitive impairment, falls between typical age-related memory loss and dementia. It's characterized by impairment in thinking, memory, and judgment that is not severe enough to require help with the activities of daily living. In other words, the person is able to function independently. Now, MCI is an ambiguous condition because often the person with MCI appears to be healthy and able to function normally in many ways, yet begins to show some signs of memory loss, confusion, and apathy. The early symptoms mimic normal age-related changes. It's important to note that physicians usually cannot predict whether or when MCI might worsen. Some people with MCI never get worse and do not develop Alzheimer's. Current studies are finding that approximately half of the people diagnosed with MCI will experience continued progression of the symptoms, leading to a diagnosis of Alzheimer's or a similar neurocognitive disorder. Pseudodementias. The definition of a pseudodementia is a condition that appears similar to dementia but does not have its root in neurological degeneration. Some examples include reactions to medications, infections, and emotional distress. These are all reversible conditions. Dementia. Dementia is a group of symptoms or a syndrome that indicate a progressive decline in cognitive functioning and behavioral abilities that have a significant impact on daily life. The word cognition refers to anything having to do with our thinking and our thought processing. It includes memory, communication skills, problem solving, reasoning, and understanding cause and effect. And behavior is what the person does. For example, a person living with dementia may become more verbally or physically aggressive, may unsafely wander, may become suspicious or accusatory, and may withdraw socially. Dementia itself is not a disease, but it's caused by more than 100 different diseases and conditions, including Alzheimer's disease, which, by the way, accounts for about 60 to 80% of cases. Regardless of what the underlying cause is, all dementias get progressively worse and are long-lasting. We have a video that we'd like to show you. And it's important to note that Alzheimer's disease and dementia are not the same. This is an area where people get really confused sometimes, and they tend to use the term interchangeably. So let's take a look at this little video that talks about just that.
What's the difference between Alzheimer's disease and dementia? Perhaps you've been confused by these terms in the past, or mistakenly thought they were the same thing. Well, you wouldn't be alone, because knowing the difference between Alzheimer's disease and dementia can be tricky. But it's actually not too hard to understand. In a nutshell, it's like the difference between shortness of breath and asthma. Shortness of breath is not a specific disease. It can have many different causes, and asthma is just one of them. Likewise, dementia is not one specific disease. It's a combination of symptoms that has many different causes, including Alzheimer's disease. Still sound a bit confusing? Okay, think of it like this. You go to your doctor with shortness of breath. Find the cause. She listens to your chest to see if it's due to asthma or pneumonia. And then she checks your heart to see if your breathlessness is caused by heart failure or a very rapid heartbeat. She even asks if you've been worried in case your breathing difficulty is anxiety related. After her examinations, she concludes that your shortness of breath is actually a nut allergy. Similarly, when dealing with dementia, your doctor needs to figure out the underlying cause. And while Alzheimer's disease is the most common cause of dementia, it's not the only one. Dementia can also be caused by vascular changes in the brain, Parkinson's disease, Lewy body disease, vitamin deficiencies, thyroid gland problems, chronic brain infections, or medications. Even a very deep depression can sometimes look like dementia, which means if someone you love has dementia, it doesn't necessarily mean that they have Alzheimer's disease. And that's very important for your doctor to establish, because some causes of dementia, such as infection, medication reactions, an underactive thyroid gland, or vitamin deficiencies, can be reversible with the right treatment. So figuring out the cause and a plan of action could improve your quality of life. And that's why, if you or your loved one have the symptoms of dementia, you need to see your doctor to find out the underlying cause.
Okay, so hopefully that little video was helpful to you. Gave you these a couple of analogies. So we learned that the difference between Alzheimer's disease and dementia. And so again, hopefully that was a helpful little video clip. And as noted in the clip, people tend to use the terms interchangeably. Sometimes even medical professionals do that. And to be honest, sometimes it's hard not to do. So let's take a quick look at some of the underlying conditions that cause dementia. Now, our Dementia Basics webinar that's posted on our website goes into much more detail about these conditions. And I've included several links on your resource list. So this is just a really quick look. As Gia mentioned, it's estimated that Alzheimer's disease causes about 60 to 80% of all of the cases of dementia. And much of the information that we know about dementia in general is based on research with Alzheimer's patients. Typically, in Alzheimer's, recent memory is the first to go. You'll also see language problems. The person misspeaks or misunderstands. There tends to be increased impulsivity and mistakes about time, place, situations. Now, while every case is unique, Alzheimer's disease can last from a few years to many years. My father-in-law had it, we're thinking for about 18 years. Now, vascular dementia is a result of major stroke or an accumulation of smaller strokes, also known as TIAs. Symptoms of vascular dementia may sometimes be difficult to distinguish from Alzheimer's disease, but often diagnostic imaging may show if someone has had a major stroke or TIAs. Vascular dementia symptoms may appear suddenly, whereas Alzheimer's tends to appear more gradually. And many of the diseases that cause dementia progress in relatively predictable stages. And this is especially true of Alzheimer's. However, vascular dementia is the least predictable, because loss of functioning is dependent upon what part of the brain has been destroyed by lack of oxygen. Now, people don't typically think about Parkinson's disease as a cause of dementia because it usually doesn't start out with cognitive decline. But about 10 years into the disease, about 70% of those who have it will develop Parkinsonian dementia. Now, I lumped Parkinson's with Lewy body dementia because both are caused by an abnormal buildup of proteins in the brain that are called Lewy bodies. Dr. Lewy was the person who identified those and, of course, named them after himself. But whereas Parkinson's starts with physical issues such as tremors, Lewy body dementia usually starts with more dementia-like symptoms, such as hallucinations and delusions. Now, frontotemporal dementia usually appears between the ages of 40 and 65. It may be misdiagnosed as a psychological problem because one of the first symptoms to appear is a drastic change in personality. It also impacts speech, reasoning, and social judgment. Now, we've just learned that this is the type of dementia that actor Bruce Willis has been diagnosed with. Primary progressive aphasia is a neurological disorder that affects the person's ability to understand and produce language. And again, this has been in the news recently because I believe those were the first symptoms that appeared with Bruce Willis. And in addition to language issues, I think I might have already mentioned this, we also see decline in thinking, judgment, problem solving, and memory. Now, a traumatic injury to the brain can cause a variety of physical and cognitive symptoms, again, just depending on what part of the brain was injured. Dementia doesn't always, but it certainly can result. And then sometimes a person may simultaneously have more than one underlying condition that causes dementia. The most common combination is Alzheimer's disease and vascular dementia. Mixed dementia symptoms may vary depending on what brain regions have been impacted. So there are many conditions that can cause confusion, memory loss, disorientation, even hallucinations, things that may appear to be what we think of as dementia. But if it can be reversed, it's not technically dementia. And Gia referred to these as pseudo-dementias. But the medical term is delirium. If the cause is discovered early enough, these conditions are generally reversible with appropriate treatment. And this is one of the reasons that it's so important to get an early diagnosis, because what may appear to be dementia may actually be due to treatable conditions. So one of the first things we always need to consider when someone starts showing signs in memory, showing changes in memory or behaviors, is we want to ask ourselves, has that person started taking a new medication? Or could a new medication be interacting negatively with another medication? Or has the dosage been changed? One of the most common causes of dementia-like symptoms are medication-related issues. Now, infections such as Lyme disease, pneumonia, urinary tract infections can produce delirium, because the high fevers that typically accompany a serious infection can cause that disorientation, confusion, and even hallucinations. Real common among the elderly are urinary tract infections. And the first indicators of a UTI may be confusion and disorientation. That was always the case with my mom. Now, with nutritional deficiencies, we're looking primarily at B vitamins, sodium, and potassium. If an elderly person shows signs of lethargy, confusion, and disorientation, you may want to ask for a blood test to determine if there's a vitamin or a mineral deficiency, because both can produce dementia-like symptoms. Or if someone is already diagnosed with dementia, these deficiencies can cause the symptoms to worsen rather suddenly. An example of a metabolic disturbance would be an electrolyte imbalance from dehydration. So dehydration is very common in the elderly. Low blood sugar can also be common. And both of these conditions, left untreated, can cause severe confusion and disorientation. But again, once treated, the symptoms should disappear. Now, emotional distress caused by major life changes, for example, the loss of a loved one, or unrelenting, unmanaged stress that a lot of us tend to experience. For example, two close friends of mine have recently lost their husbands, and I keep reassuring them that they don't have Alzheimer's or dementia, but that they're suffering from grief dementia. It's very common, and the more they worry about it, the worse it gets. This is where some therapy and support groups can really come in handy. Now, is the fact that someone is not processing newly acquired information due to vision or hearing loss? Because we can't remember or understand information that we didn't see or hear in the first place. So before we jump to the conclusion that someone is not remembering what we told them, let's be sure that they're hearing us in the first place. So it's important to remember, if someone shows sudden signs of memory loss, confusion, disorientation, or any other behavioral change, we always want to check for another cause before assuming that they have one of the diseases that can cause dementia.
So before we talk about how dementia affects the brain, there was a question that popped up in the question box asking about traumatic events like a house fire and the loss of a loved one back to back. And can that cause some of these reversible dementias? And I think Debbie answered that question after the question was typed in, but I'll go ahead and answer it again. Yes. As Debbie said, emotional distress caused by major life changes or unrelenting and unmanaged stress. So absolutely, and you're welcome. I see the thank you in the questions. Okay, so when people think about what dementia is, they typically think about something that robs someone of their memory, or maybe something that causes people to behave out of character. And both of those two characterizations are true. However, because dementia is a condition that causes the brain to deteriorate, its impact is far greater than just memory decline or atypical behaviors. Nearly every aspect of brain functioning is ultimately impacted by this degenerative syndrome. As we know, our brains are responsible for every bodily function. Memory and language do tend to be the abilities that are hit first and hardest. But in addition to memory and language, dementia impacts all of these other brain abilities: vision, perception, motor skills, both fine and large motor skills, reasoning, judgment, abstract thinking, and attention. Also, it impacts one's mood and personality. In fact, noticing changes in a loved one's personality may be one of the first things family and friends notice in early dementia. We go into greater details about the ways dementia impacts in our dementia basics class. And if you missed it, no problem. It's one of those pre-recorded videos that are on our website.
Okay, so if someone is exhibiting the signs and symptoms of dementia that Gia talked about, or that I talked about also in the last slide, it's important to get a medical evaluation. Visiting a primary care physician is often the first step for people who are experiencing changes in thinking, in movement, or behavior. However, consulting a physician who specializes in disorders of the brain and the nervous system is your best bet in getting a thorough workup. Your primary care physician can help you to find one of the following specialists. So these are the four most common specialists that are going to deal with brain and neurology. So a neuropsychologist is not a medical doctor, but is a specialist in a branch of psychology that deals with understanding the relationship between the brain and behavior. By using specialized tests to assess cognitive deficits, these neuropsychologists, they can diagnose dementia as well as help in the management and treatment, should there indeed be a dementia diagnosis. Now, neurologists are medical doctors who specialize in diagnosing and treating disorders that affect the brain, the spinal cord, nerves, and muscles. Geriatric psychiatrists are medical doctors who focus on preventing, evaluating, diagnosing, and also treating emotional and mental disorders, and primarily in adults who are over the age of 65. A geriatrician is a physician who specializes in treating conditions that affect older adults. And this is an increasingly rare specialty, unfortunately, in part because Medicare has low reimbursement rates and many geriatricians earn less than other specialists. So again, you can always get a referral from your primary care physician should you suspect a dementia diagnosis or dementia symptoms. All right, so let's look at a typical assessment that's given when the warning signs of Alzheimer's or other dementias appear. Now, I know we keep saying this, but it's so important to get a prompt and an accurate diagnosis. Now, while doctors may not be able to make a definitive diagnosis of what may be causing the cognitive decline, many of the assessments can point them in the right direction, and just as importantly, rule out other causes, especially those that are treatable, like we talked about a few slides ago. Now, to determine if the symptoms indicate dementia, a physician will perform a thorough medical exam with the components that I have listed here. By the way, as a patient, it is really important that you are honest. During the appointment, your doctor will also evaluate whether you have impaired memory or thinking skills, and whether you exhibit changes in personality or behavior. Very importantly, they're going to look at how your thinking problems affect your ability to function in daily life. This assessment will typically include an interview with a family member or somebody who knows you really well. By the way, cognitive assessments are supposed to be performed each year as a part of Medicare's annual wellness visit. So if you're not seeing this for yourself or for a loved one, be sure to ask about that. So since the diseases that cause dementia can affect motor skills, reflexes, and reaction time, the doctor will perform some simple neurological exams. They may order blood, urine, and brain imaging tests to determine a possible cause of the dementia symptoms. These tests can provide useful information for diagnosis, including ruling out other treatable conditions that mimic depression. Again, those pseudodementias. This testing can also establish a baseline about the degree of cognitive and functional degeneration. So an MRI or a CT study of the brain may be used to search for evidence of previous stroke, tumors, or brain bleeds. But most scans of the brain are not yet accurate enough to determine the cause of dementia, including Alzheimer's. However, since one of the main theories about the cause of Alzheimer's involves a buildup of beta amyloid plaque, there's a relatively new diagnostic test, and it's called an amyloid PET scan. It may be of value. Now, the problem here is that this scan costs about $5,000 and is currently not covered by insurance, although I've been hearing some rumblings that that may change. Now, a less expensive test that may point to Alzheimer's is an analysis of cerebrospinal fluid. And this test is less expensive and it is covered by insurance. However, it does involve an uncomfortable spinal tap. So we're getting closer to being able to diagnose Alzheimer's disease before an autopsy is performed. So there's different cognitive tests that can be used to evaluate memory, judgment, and ability to understand information. And I've listed 3 examples here. The general practitioner assessment of cognition is a tool that's been designed to be used by primary care physicians and family doctors. Now, the mini-cog is a 3-minute instrument that can be used to screen for mild cognitive impairment, primarily in older adults. It consists of 2 components, a 3-item recall test for memory and a clock drawing test. Now, as a screening test, it does not substitute for a complete diagnostic workup. And then the Montreal Cognitive Assessment, or MoCA, is one of the more precise screening tools, and this must be administered and scored by a healthcare professional who is trained and certified. Now, you can find some of these or bootlegged versions online, but I don't recommend this because this is one area where DIY can be dangerous. And remember, just one of these cognitive screening tools is not enough to conduct a thorough evaluation. Someone can score high on one of these tests, but still not be able to recognize their grandchildren or remember how to get home.
A diagnosis can be very scary, and many people are in denial that they have any symptoms of dementia. In fact, most people with Alzheimer's dementia don't even get a diagnosis until they're into the 2nd or moderate stage of dementia. We're going to spend the rest of today's webinar explaining why it's so important to get an early diagnosis. As with anything in life, the more we know, the better equipped we are to navigate our next steps. Taking charge or gaining as much control of the situation as possible helps to empower us. Knowledge is power. An early diagnosis is an opportunity to information gather and to plan. Educate yourself about dementia and learn what resources are available. This is the time to form a care team. Review your legal documents and be sure everything is up to date and reflects your wishes.
Okay, so let's take a look at emotions for a minute. Psychologists who study language believe that the words we use to label or describe something have a huge influence on how we think about it, how we perceive it, how we understand it. I know that personally, whenever I slap a label on something, a light bulb goes on because that label helps me to process whatever's going on, especially when I'm faced with overwhelming emotions. So it can be helpful to identify and understand some of the emotions that you may experience after receiving a diagnosis. Now, it's very common for people to grieve when they receive a diagnosis, even though most would not identify that emotion. Many people think that grief is only felt after someone dies. However, we experience grief anytime we experience a loss or an anticipated loss. So, of course, receiving a troubling diagnosis can send us into a state of grief. We grieve over the thought of losing our abilities, the expectations that we won't be able to do the things that we'd hoped to do in our future. We grieve over the expected loss of independence. Now, care partners also experience grief with a diagnosis. Knowing that there's going to be major changes in one's life, we grieve for what once was. As a care partner's role shifts from that of an adult child or a spouse to one who assumes much of the responsibilities of providing care, we grieve the loss of the relationship as it was. I know that as my mom's dementia progressed and our relationship changed, I really started missing my mom and our old relationship. Now, a really close friend of mine has Alzheimer's, and she just moved into an assisted living facility. I visited her recently, and I found that I was already missing our friendship. Knowing that our relationship has changed and will change even more greatly once her Alzheimer's progresses, it's really hard for me. I felt an overwhelming sense of despair, and I know she did too. Now, denial is a very common emotion. The diagnosis seems impossible to believe, and some family members and friends may also be in denial, especially if they're not around as much as the primary care partner is. I know my brother was in denial for a long time about our mom's condition. Now, by the way, denial is one of our brain's ways of protecting us from something that's overwhelmingly troubling. Now, I'm sure you've heard the expression, ignorance is bliss, but I always like to counter with, and I know Gia mentioned this in the last slide, knowledge is power. And in the case of a dementia diagnosis, that is so true. Now, many people become angry because life is taking a different course than the one you and your family had planned. You can't control the course of the disease, but it's okay to be angry because life is not fair. And of course, there's fear about what the future holds and how you and your family are going to be affected. You may be asking yourself, what did I do to deserve this diagnosis? Why is this happening to me or my loved one and not someone else? By the way, it's not unusual to resent others who don't have dementia. Now, those with a dementia diagnosis may feel as if no one understands what they're going through, or they may lose interest in maintaining relationships with others, so they isolate themselves. I'm seeing this with a friend that I just mentioned who moved into assisted living. So I keep gently nudging her to stay in touch with her friends and let them know what's going on. But facing friends right now is really painful for her. And I hope in time that that's going to change. Because maintaining close relationships with others is one of the most important ways to keep our brains active and healthy. And then, of course, there's sadness and hopelessness over the way your life is changing. Depression is very common. But if that depression lingers week after week, it's really important to see your doctor to see if you might benefit from an antidepressant. Now, some people may experience a sense of relief once they have an actual diagnosis, because a diagnosis can validate your concerns and give a name, that label, to your symptoms. So it's completely normal to be experiencing any and all of these emotions because it means that you're a human being. And the more you and your family learn about dementia and what to expect, perhaps you may even feel hopeful that you're going to do your best to live well with dementia.
Handling emotions. Now, unpleasant emotions exist, whether we choose to acknowledge them or not. So, coming to terms with your diagnosis and the emotions you're feeling will help you to accept your diagnosis, move forward, and discover new ways to live a positive and fulfilling life. Regarding her diagnosis, one patient said, quote, "My reaction to her diagnosis was one of both sadness and relief. Sadness because I knew what was ahead, relief now that I knew I could take steps to prepare myself for a different life." You are the only person who can change how you feel about your diagnosis. So it's important to find healthy ways to deal with your emotions. And this can be difficult at the beginning. But once you make the commitment to take care of your emotional needs, you may find that you can rise to the challenge and face your diagnosis. This is a new phase of your life, and you can choose to experience it with a sense of connection to your emotional health. When working through your feelings, try a combination of approaches. The following tips may be helpful. Write down your thoughts and feelings about your diagnosis in a journal. I preach this to the support groups that I run all the time, that sometimes the physical act of getting things down on paper helps us to accept and then release what it is that we're thinking and we're feeling, even if it's just words as opposed to complete sentences. Also, you may find your friends and family struggling with your diagnosis and their feelings. You can create a space where they feel comfortable sharing with you by you sharing with them. Speak openly and honestly about your feelings. Tell them what you're still comfortable doing. Let them know when you need help and support and what they can do to help. And then when they offer, take them up on it. Surround yourself with a good support system that includes individuals who are also living in the early stage of the disease and understand what you're going through. There are both online and in-person support groups. And incidentally, that resource page we mentioned, there's some listed here too. Specifically, Hope Hospice offers support groups for caregivers of a person living with dementia, as well as our bereavement counseling. Join a support group that can provide you with a safe and supportive environment of peers. Talk to your doctor if you or others are concerned about your emotional well-being, and your doctor can determine the most appropriate treatment plan to address your concerns. Maybe seek help from a counselor or a clergy member. He or she can help you to see things in a new way and help you to understand more fully what it is you're feeling. And stay engaged. Continue to do the activities you enjoy for as long as you are able. Remember that a dementia diagnosis does not define who you are as a person. You are still you. Take the time you need to feel sad, mourn, and grieve, and then pursue those roles that do define your self of purpose. You're still a spouse, a parent, a grandparent, a gardener, a volunteer, etc. No two people deal with their diagnosis in the exact same way. There is no right approach. Some days may be more difficult than others. And when you get discouraged, regroup and try again tomorrow. So we've got another video to show you. And in this short one from the Alzheimer's Association, we hear from some individuals who've received a diagnosis of Alzheimer's disease. Let's hear what they have to say.
I think accepting a diagnosis is a process, and everybody faces that differently. But for me, I had to mourn my old life and embrace my new life. And part of that was moving from why me to what next.
I just concentrate on what I did today, what I'm going to do tomorrow, what comes will come.
In order to accept your diagnosis, I think the first thing you have to do is to not isolate yourself. Surround yourself with other people who you can interact with. That really will make a difference. It did for me.
I think day by day, week by week, it just starts getting easier. It's like losing someone. And so I think I've gone through all the grieving stages. And so the shock is gradually wearing off, but every once in a while it rears its ugly head and I deal with it.
There's life after an Alzheimer's diagnosis. I didn't believe it in the beginning, but I found it to be true.
So when you learn that you have Alzheimer's disease or a related dementia, you may not believe it, or you may feel overwhelmed, confused, or angry. It's natural to be hesitant to tell family and friends about your diagnosis due to concerns about how they will react. Or maybe you worry that they'll treat you differently. You may not want sympathy or help, but you may want the people you're close with to know because you care about them. Having the support and understanding of your family and friends can help you enjoy life and live more independently. As the condition of dementia progresses, you will need the support of those who know and understand you. Concealing or denying your diagnosis will limit your ability to cope with the challenges ahead. It's normal to experience fear or discomfort about sharing your diagnosis. However, talking openly with those you trust is a powerful way to educate those around you about the disease and to engage their support. So, who do you tell and when do you tell them? You may want to plan in advance to tell someone, or you may just want to wait until it feels right. Chances are that they already have a sense that something is going on. It may make them feel better to have you explain what's going on with you. And most likely, it will make you feel better. Dementia can be like that pink elephant in the middle of the room. Everyone knows it's there, but they may feel uncomfortable talking about it. Tell others that even though you have dementia, there are still many things you can still do for yourself, and that you want to be as independent as possible for as long as possible. But people need to know that sometimes you'll forget things, or that you may have difficulty concentrating. Let others help you. It will make them feel good. So tell them how they can help. Maybe it's as simple as asking them to be flexible and patient with you. Educate others. The more people learn about your condition, the more comfortable they'll feel.
Okay, I just want to make a really quick comment about the source that's listed on the bottom of this page, the Taking Action Workbook. If you don't look at any other source on the resource list, please take a moment to look at this one. It's excellent. And a lot of the information that we're sharing with you in today's webinar was based on info that we found from that particular workbook. So I really encourage you to take a look at that one. Okay, sorry about that, Gia.
No, that's great point out right there. Thank you. So a care team. A care team is the group of people who you'll partner with and rely on to provide you with help, care, support, and connection throughout the course of the disease. This might include specialists in the brain and the nervous system, family, friends, and neighbors, in-home caregivers, support groups, etc. Be sure to include senior centers when you're looking into community groups and resources. And remember, mental health is just as important as physical health for both the patient and the caregivers.
All right, I'd like to talk about some of the approved treatments for dementia. All the information about treatments, by the way, can be found on the resource list. So I'm just going to talk about a few. Treatments vary based on the cause of dementia. So depending on the underlying condition, certain medications are contraindicated and can actually make symptoms worse. So again, for these reasons, an accurate diagnosis is critical. When considering any treatment, it's important to have a conversation with a healthcare professional. Physicians with experience in using these types of medications should monitor their patients to ensure that the recommended guidelines are strictly observed. Now, the FDA, Food and Drug Administration, has approved some prescription medications that may temporarily lessen the symptoms and stabilize the cognitive decline. Treating the symptoms can provide people with comfort, dignity, and independence for a longer period of time. It can also encourage and assist their care partners as well. The class of prescription medications typically used to reduce or control some of the memory and thinking problems of mild to moderate dementia are called cholinesterase inhibitors. Three of the most common drugs are Aricept, Exelon, and Razidine. Because all cholinesterase inhibitors work in similar ways, switching from one to the other may not produce significantly different results, but someone might respond better to one drug versus another. Now, these are typically prescribed for Alzheimer's dementia, but they also seem to work well if someone has a diagnosis of Lewy body dementia. Now, glutamate regulators, such as Namenda, are used to treat moderate to severe dementia that's related to Alzheimer's disease. It's not a cure, but it may improve memory, awareness, and the ability to perform daily functions, possibly slow the progression of the symptoms. Now, as we know, dementia affects more than just memory and thinking. A person's quality of life may be impacted by a variety of behavioral and psychological symptoms, such as sleep disturbances, agitation, hallucinations, possibly delusions. Some commonly used medications like antidepressants or anti-anxiety meds can treat the symptoms for a time. However, before turning to medications, it's really important to try non-drug strategies to manage some of these behaviors. And we'll take a look at those in just a moment. So you may have seen the headlines about new treatments for Alzheimer's. They've received, and these treatments have received what's called accelerated approval. The two we're going to look at are Aduhelm and Leqembi. Now, instead of just managing symptoms, these are the first medications for mild cognitive impairment or early Alzheimer's that are known as disease-modifying treatments. It's important to note that while it's not a cure, studies have indicated that by reducing the beta amyloid plaques, that's that sticky stuff in the brain that interferes with neural transmissions. So by reducing that, possibly cognitive and functional decline may be slowed. However, there is no evidence to show that it restores lost memories or functions. And right now, these meds have been shown to be effective only in early stage Alzheimer's or mild cognitive impairment. So candidates must undergo a thorough medical evaluation and be diagnosed with early stage Alzheimer's or MCI to qualify. And doctors must determine that the patient already has a buildup of amyloid plaque in their brains. So both of these drugs are administered by infusion, intravenously, every few weeks, and this is usually done in a clinic. Insurance coverage is inconsistent right now. Medicare has recently approved coverage for Aduhelm, and the VA is providing coverage in some cases. So you'll need to check with your individual insurance provider. However, keep in mind that these new drugs are controversial for a variety of reasons. Many scientists believe that the approvals were rushed. There's concern that the drugs only address one of the hypotheses of the causes of Alzheimer's, that the disease is caused by that buildup of amyloid plaque. And there is serious concern that there's not been enough research about the side effects of the medications, some of which can be really serious. So anyone with a suspected diagnosis of MCI or early stage Alzheimer's may want to talk with their doctor to see if either of these new meds will be a good option. But again, be sure you've done your research and homework. Now, a recent survey from Harvard Health found that about 25% of adults over the age of 50 take an over-the-counter dietary supplement to improve their brain health. Now, the problem with this, there is no solid proof that any of them work. A growing number of herbal remedies and dietary supplements are promoted as memory enhancers or treatments to delay or prevent dementia. However, claims about the safety and effectiveness of these products are based mostly on testimonials, word of mouth. There's been very limited scientific research. It's not necessary for any supplements such as vitamins or herbals to get FDA approval because technically they're not food or drugs. So the maker of a dietary supplement is not required to provide the FDA with the scientific evidence for its safety and effectiveness. Also, supplements might be manufactured, may not be manufactured consistently or always contain the ingredients that are listed on the label. And some herbal and nutritional supplements can have harmful interactions with prescribed medications. So no supplement should be taken without first consulting a physician. And you should always inform your doctor if you're taking these supplements. Many people assume that anything sold over the counter must be safe, and that's not always the case, especially among the elderly. Now, a couple of the more common so-called brain health supplements, Prevagen and Nariva, are pretty heavily advertised on TV. Both, however, have been fined for making false claims. So now they're pretty careful not to claim that they're intended for those with moderate or severe memory loss. So before deciding to take Prevagen or Nariva or any other supplement that claims to help with memory loss, it's important to talk with your healthcare provider. And remember, none of these products were meant for people who've received a dementia diagnosis. Okay, dietary supplements. So let's take a look at some of the other dietary supplements that people use for memory enhancement. By the way, most people don't really need to take supplements because a healthy diet should supply you with all of the nutrients that you need. But some of us don't always eat the healthiest of diets. Since these products are not regulated, you're never certain about the purity of the substance. And some dietary supplements can have serious interactions with prescribed medications. So no one should take a supplement without first consulting a physician. You've probably heard about omega-3 fatty acids. Theories about why they may reduce dementia risk are based on their benefit for the heart and blood vessels. They've been shown to have anti-inflammatory effects, and they protect nerve cell membranes. So since issues with the circulatory system, the heart and blood vessels, are one of the main causes of dementia, it makes sense that anything we can do to contribute to heart health can certainly reduce our risk of getting vascular dementia. Research has linked a diet high in omega-3s to a possible reduction in the risk of cognitive decline. But, and this is an important but, any benefit seems to come from a greater intake of fatty fish like salmon and not from taking those fish oil supplements. Now, healthy diets like the Mediterranean, the DASH diet, the MIND diet should supply you with all the omega-3s that you're going to need. And we'll take a quick look at those in just a minute. B vitamins, especially B12, all play a role in brain health. A simple blood test can determine if you have a vitamin B deficiency. As we age, our intestinal tract loses its ability to absorb some of the vitamins from our diet. So it is possible to have a vitamin B12 deficiency. But unless you have a deficiency, as detected on a blood test, a supplement is unlikely to help. Now, vitamin D is important for bone and muscle health, and there's a correlation between low levels of vitamin D3 and dementia. But as of now, there's no research to support that vitamin D3 supplements will slow cognitive decline. Now, but it's important to note that vitamin D is what's called a fat-soluble vitamin, which means that taking too much of it in supplement form can be toxic. And vitamin D toxicity may lead to bone pain and kidney problems, such as the formation of calcium stones. All right, ginkgo. So the leaves from the ginkgo tree are used in traditional Chinese medicine, treating all kinds of ailments. And one of its main selling points is as a memory enhancer. However, as with other brain supplements, the science doesn't support the claims. Although some studies have shown slight improvements in cognitive function for people taking ginkgo biloba, most experts feel that it hasn't lived up to its early promise, and they don't recommend its use as a memory aid. So, with no evidence, why do people still buy into brain health supplements? Well, a major reason, I think, it's easier to take a pill than to make lasting lifestyle changes, such as exercising and following a healthy plant-based diet. These actually can help with memory loss and brain health, with memory and brain health in the long term more than any supplement. And more on that in just a moment. Okay, Gia.
Sorry, I forgot to unmute. Good Lord. There is no magic pill that will take away cognitive impairment. Remember, persons living with dementia have challenges letting us know what it is that they're trying to convey to us. And sometimes this results in patients acting out or behaving in a way that's distressing to them and others around them. It's the family's and the caregiver's job to figure out what strategies to try, diffuse and respond to unwanted behaviors. This is what we refer to as non-pharmacological interventions. So a simple example of this might be a patient who gets agitated in the late afternoon, maybe around 4 o'clock, right when caregivers are trying to get dinner ready. The patient may pace and repeatedly ask what time dinner is, or maybe try and leave the house saying, I need to go, I need to go. One thing to try may be to offer a small snack just before the behavior typically starts. It's possible that this person is hungry and he or she can't verbalize their need. Or maybe they're feeling unsettled because all the caregivers are busy with tasks and therefore the person is bored or lonely. Asking them to help with dinner preparations by offering a simple task may make a difference. Oh, Sally, could you help me? Can you tear this lettuce for the salad? Or something else. Look for possible reasons behind the behaviors and see what you can do to address those. Plan ahead with opportunities for meaningful connections, like the salad preparation. You can both be in this kitchen at the same time. Maybe it'll lead you down the path of reminiscing when you used to do this a long time ago. Try not to get so focused on the tasks, though, that you forget about what the person might be feeling. When you've always cooked and provided dinner for your family, it can be hard to allow someone else to cook for you. Involving them by asking them for help and then maybe engaging them in conversation or reminiscing can make a difference. We all need to feel useful, and most of the time, we all enjoy reminiscing about positive things from the past. Music therapy. We know that persons living with dementia can respond to music and other types of rhythm late into the disease, even if they become nonverbal or aren't recognizing names and faces anymore. Using rhythm to make connections or to transition from one task to another can be an incredibly powerful tool and very helpful. And rhythm doesn't just mean music. It can also mean the rhythm of your language. Listening to poetry can provide a sense of calm for someone in the advanced stages of dementia. And additionally, there are studies that show that listening to music can help stimulate seemingly lost memories and maybe even help maintain some cognitive functioning. Environmental approaches and modifications. We can also try changing the environment to resolve challenges and obstacles to comfort, offer security, and peace of mind. What this looks like will vary depending on the person's personality, but in general, the ideal environment for a person who's living with dementia is one that is non-stressful, one that is consistent and familiar. Keep in mind, though, that a person who's always been, say, extroverted will most likely continue to be extroverted. That may mean that they need more stimulation than, say, someone who's always been kind of quiet and introverted. It's really important to know your person living with dementia well and make sure that the caregivers have this information too.
Okay, so here's the bottom line. Right now, we can't prevent Alzheimer's and other dementias, nor can they be cured. But the good news, with lifestyle adjustments, we may be able to reduce the impact of the cognitive decline that's associated with dementia. This is one of the easiest ways that we can take charge of our health. So it's been said that's what's good for the heart is good for the brain. And many of the things that we do for heart health can really help with vascular dementia, which is actually the second most common type. And some autopsy studies show that as many as 80% of individuals with Alzheimer's disease also have cardiovascular disease. So whatever we do to reduce our risk of heart disease may reduce our risk of Alzheimer's and maybe even other dementias, or slow the decline if we already have a diagnosis. Now, we all know these healthy habits already. Nothing new here. Exercise, eat well, manage blood pressure with meds if necessary, cut out the smoking and limit the alcohol. They're all important and they all help. Managing stress is easier said than done, but we have to try. Unrelenting, unmanaged stress can take a toll on our heart and on our brain. However, if we try to make that fight or flight stress response work for us, make us more productive and creative and compassionate, maybe we can use stress to our advantage like professional athletes and performers do. Now, not only is sleep necessary for our physical health, it's crucial for our mental health and our cognitive functioning. When we sleep, our brain continues to process, to sort, and to store memories from the day. Have you ever noticed that when you're sleep deprived, you tend to be more forgetful? I know that's sure true for me. We all know how important preventative medicine can be. Now, research recently presented at the Alzheimer's Association International Conference suggests that flu and pneumonia vaccinations, especially multiple vaccinations over time, are associated with a lower risk of Alzheimer's in later life. Now, it may turn out to be as simple as this. Those of us who take care of our health by getting vaccinations and preventative medicine may also be taking care of ourselves in other ways. And all these things add up to helping manage Alzheimer's and other dementias. But researchers have found that people ages 65 to 75 who had received the pneumonia vaccination had a 25 to 30% reduction in their chance of developing Alzheimer's. So I'm hoping that all of those COVID vaccines that we've been taking fall into this category as well. Staying socially engaged is another thing that took a hit during COVID. It's easy to get into the habit of isolating simply because everything else is so complicated. But it's so important to maintain your social connections. It's important for your social and emotional health, and ultimately your physical health. Now here's the biggie. Learning new information and challenging your mind builds up what's called a cognitive reserve. In other words, new neural pathways on which information can be sent or processed if another pathway has been destroyed by blood clots or gummed up by Lewy bodies or that Alzheimer's beta amyloid plaque. So it's kind of like if the road that you usually take to get somewhere has been closed, is there another way you can get there? Is there another road that will connect you between point A and point B, a detour? So to stave off the effects of dementia, we need to form as many detours in our brain as we can, so that if one road is damaged, there's an alternative. So that's what we mean when we talk about cognitive reserve. You may have also heard this referred to as neural plasticity. Now, in the past, we've heard that doing crossword puzzles is good for your brain. And while crosswords or other puzzles are definitely good, they're not nearly as good as learning another language or a new skill, either an intellectual one or a physical one. By the way, I recently read a study that showed that playing ping pong was an especially good activity because it can simultaneously activate 5 different areas of the brain. So it's great for both physical and brain health. These days, pickleball is pretty popular. I'm wondering if that one might do the same thing. So challenging ourselves however we can is the best strategy for building up that cognitive reserve. We need to do this daily. Use it or lose it applies to the brain just as it does to every other part of our body. So try to make your health and well-being a priority and encourage those you love to do the same thing. So I mentioned healthy eating a couple of times. There is strong evidence that certain diets, like the Mediterranean and the DASH diets and the MIND diet listed here, can help improve cognitive function. These diets contain foods with large amounts of vitamins, minerals, fiber, healthy fats. So I do want to talk about the MIND diet for a moment. This is a combination of the Mediterranean diet and the DASH diet, which was originally developed to reduce hypertension. The MIND diet is a brain-healthy diet that stands for Mediterranean Dash Intervention for Neurodegenerative Delay. I'm glad there's an acronym that's easy. So in the MIND diet, the recommended guidelines focus more on plant-based foods that are minimally processed. It limits animal-based foods that are high in saturated fats and foods with added sugars. So the diet also recommends portion control, but unlike most diets, it doesn't focus on weight loss. Now, as you can see on this slide, the MIND diet includes 10 food groups that you should eat from regularly and 5 categories to limit. Now, while you don't have to completely cut out meats and dairy from your meals, the diet does recommend eating them sparingly. In other words, less than 4 times a week. The diet recommends substituting red meats and dairy with protein-packed beans and legumes that are important for brain health. And there is actually legitimate scientific evidence that supports how adhering to this MIND diet can actually reduce your risk of cognitive decline. So I have a link to information about the MIND diet on my resource list, so you can take a look if you need more info. So making healthcare decisions, either for yourself or someone who's no longer able to do so, can be overwhelming. That's why it's so important to discuss preferences early, while the person with dementia is able to make decisions and can still participate in legal and financial planning. It's important that healthcare and financial arrangements are in place before serious illness or before a healthcare crisis. This slide gives you some basic tips for getting your legal affairs in order. So since we're actually getting a little bit short on time, I'm not going to elaborate on these, but for more details, take a look at one of the resources that I've listed here, and that's the one from the National Institutes on Aging. So financial planning is even more important after a dementia diagnosis. So be sure to work with family members and develop a financial plan. And if your finances are complex, consider meeting with a financial planner. This planning also includes having a plan in place for long-term care. Unfortunately, most of us are probably going to need it. Also kind of look at the options that are available to you for paying for that long-term care. Now, that Taking Action workbook that's listed here, I mentioned it earlier. This is an excellent resource for this particular topic.
So it's estimated that 60% of people living with dementia will wander from their homes and get lost. So be prepared. Try using identifying bracelets and necklaces with the person's name and phone number that can be called in an emergency. And to reduce the chance of these pieces of jewelry being removed, look for a bracelet that requires 2 hands to remove. We've listed the name of a company on the resource list, Medical ID Fashions. And by the way, there are a variety of styles to choose from. Keep a recent photo handy so that you aren't scrambling to find what you need in the middle of a crisis. For home safety, make minor changes in the home to create a safer environment to prevent falls and injuries. Reduce clutter and install grab bars and other assistive devices throughout the house, especially the bathroom where most falls occur. Try using non-skid shoes. Consider safety devices like fall monitors and emergency call buttons. And by the way, the Alzheimer's Association, in collaboration with Medical Alert Foundation, offers a 24/7 wandering support program. This nationwide emergency response service facilitates the safe return of individuals living with dementia who wander or have a medical emergency. Members are required to purchase an ID bracelet or accessory and a membership to participate in the Wandering Support Program. And by the way, you may be wondering what the picture on this slide is. It's a picture of the insole of a shoe. And we're showing you this because there are locator devices that can fit into your shoe to make it easier to track someone when they've wandered. Technology these days is amazing, and there's lots available out there to aid with personal safety. And again, that resource in your resource list, which is the workbook called Taking Action, has a lot of information about this as well. So be sure you check it out.
Okay, Gia, thank you for clarifying, because that little graphic looks kind of like a spaceship. So, all right. Is it safe to drive? This is a tough one. People with very mild Alzheimer's may be able to drive safely in certain conditions, but as memory and decision-making skills worsen, they probably need to stop. Actually, they do need to stop. Of course, there's the issue with getting them, of course, there's the issue of them getting lost. But even worse, they may not be able to react quickly when faced with a surprise on the road, and someone could get hurt or killed. So while giving up driving doesn't seem to be a major issue for some people, for others, it represents a surrender of independence or a loss of their freedom. Even early Alzheimer's disease can make it hard to drive safely because the disease can cause temporary confusion, even in familiar areas. And as I mentioned, it also slows one's reaction time. So some people with dementia will decide on their own not to drive, while others may deny that they have a problem and refuse to listen to others. And we know they also have a difficult time understanding logic. So that's another factor. So if you drive, talk with your doctor about changes in your reaction time, focus, and memory. And if family and friends express concern about your driving, please take them seriously. Now, I've listed some of the warning signs that indicate that a driver may no longer be safe. Now, many of us, me included, will be guilty of some of these on occasion. But what we're looking for is a pattern of unsafe behavior, such as incorrect signaling, confusing the brake and the gas pedal, driving at inappropriate speeds, either too fast or too slow, frequently hitting curbs. Okay, I do that one, but I've always done it my entire life, so I'm not going to worry that it's a dementia indicator. Getting new dents or scratches. Remember, we're looking at the pattern. We're looking at all these things happening on a regular basis. Getting lost going to familiar places. And the key here is familiar places. driving on the wrong side of the road, failing to stop, making sudden impulsive lane changes. We also want to look out for other health issues that may impact one's ability to drive safely. So any changes in vision, hearing, or mobility. So although family and friends can watch for signs of unsafe driving, a proactive strategy would be to get a comprehensive driving evaluation. So I've listed links on your resource list to all of these options I have listed here. And by the way, if you're providing care for a person with dementia, you can get handicapped placards and plates for your car. Being able to park in the handicap spots that are closer to your destination can be really helpful. So all you need to do is pick up an application. The local AAA offices have them, or you can get one online. Some doctors' offices actually have them. And all you need to do is ask your doctor to complete the physician section of it. It's really, really easy to do. So I found this short video online and I wanted to share it with you because I think the analogy that this woman uses to describe what it's like to live with dementia is spot on.
Dementia is really supposed to look like. Although I have some really good moments when I feel like I can accomplish just anything, I also have moments when confusion and disorientation take control of my emotions, my actions, and my body functions. Dementia doesn't just happen overnight. You don't just wake up and go, oh, I don't know anybody. Sometimes it's a long, slow process, slowly eating away at your memories. I think Barry Pankhurst was the first person I heard use the analogy of dementia being like a Christmas tree. I think it's so appropriate. Think of a beautiful tree, all decorated with lots of new lights and ornaments and ribbons. One day, one of the bulbs start to flicker. And you tap it a little, and it comes back on for a little while. Over time, another starts to flicker, and then another and another. Sometimes you can get them to come back on, and sometimes they just stay on. So you make adjustments to distract from the burnout lights. Move an ornament, add some tinsel to make the light, to enhance your lighting. All the while this is happening, your tree remains beautiful and brightens the room. People who don't see your tree very often, or who visit during the daytime, may not notice that the lights are flickering, or the ones that are totally burnt out. But you know, in time, most of those bulbs are going to totally burn out. I have times when my lights flicker and some of those bulbs don't want to come back on. For example, with math and counting money, I'm not very good at those anymore. But for now, enough lights are still shining. I can try to brighten the world. Physically, I'm strong and healthy. My husband Ryan and I have found that I can do many things that I did before. I just have to do them differently. We try to find an adjustment to compensate for the flickering bulbs. Sometimes people say, you don't look like you have dementia. And I'm thankful that my lights aren't flickering, or that we've made the right adjustments, that they can't see the lights flickering. For now, my tree stands tall and bright and beautiful. With routines and adjustments, I'm able to live a beneficial, happy life. The day may come when most of my lights are dim. But for now, I'm thankful for all the days when I can be useful. My husband often reminds me, even during the daytime or when the lights are off, a Christmas tree is still beautiful. I'm not the same Laurie I was, but with adjustments, planning, and routines, my lights can still sparkle bright.
Okay.
So we are coming to the end of our presentation, but we've got a couple last things that are really important to recognize. So bear with us for just a couple more minutes. Listed on the screen in front of you are some really great suggestions on how to manage on a day-to-day basis. Begin with establishing a routine that will be familiar. We all like to know what's ahead, and by creating a routine, that gives us something to count on, especially when so much in our lives is uncontrollable. For example, always hanging your keys in the same place or brushing your teeth before you put on your pajamas. Using an easy-to-see whiteboard or a large calendar to track appointments and activities can help to cut down on the instances of repeated questions, as well as offering autonomy. If a person can glance up and see what time it is easily on the wall, they might not need to ask the time so often. Avoid multitasking. Stressed or compromised brains have a really hard time managing multiple tasks at one time. As a caregiver, slow down. Be aware of self. If you are feeling overwhelmed, stop. Take a break, take a breath. Taking a step back can allow you the opportunity to look at a situation a bit differently. When something doesn't work, try again later. And when you do, try something different. Sometimes the solution to a problem can be as simple as taking a different approach. And lastly, like I mentioned earlier, creating reminder notebooks can help. Getting something down on paper can make a huge difference. Use medication reminder systems. Those little pill boxes that you can buy at the drugstore can be helpful as well. So, this has been a lot. Take a deep breath and remind yourself to be gentle with yourself. Try to accept your changing feelings as a part of living normally with dementia. Try to work through the bad ones to get to the good ones. Those feelings are still there. Don't isolate yourself. Enjoy more time with friends and family. Stay active by participating in activities that you enjoy. Music and exercise are two of the best. Maintain connections. Who and what gives you comfort? This can be anything. Don't forget to ask for help. Not only is this beneficial to you, but it gives others the opportunity to feel like they're supporting you. Like I said, be gentle and easy on yourself. You're still learning to live with your new normal.